The doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet and in the cause and prevention of disease. The person who takes medicine must recover twice, once from the disease and once from the medicine. There's rosemary, that's for remembrance. Pray for you, love, remember. Chronic obstructive pulmonary disease, COPD, which includes chronic bronchitis and emphysema, is a long-term lung disease that makes it hard to breathe. The good news is COPD is often preventable and treatable. Here you'll find information, resources and tools to help you understand COPD, manage treatment and lifestyle changes, find support and take action. Newly diagnosed with COPD. Chronic obstructive pulmonary disease, COPD, includes both emphysema and chronic bronchitis, and how your lungs are impacted when you have one or both diseases. If you have been newly diagnosed with COPD, emphysema, or chronic bronchitis, you may have a lot of questions. In addition to partnering with your healthcare team, the steps below can help you better understand and manage your diagnosis. Step 1. Learn about COPD. COPD stands for chronic obstructive pulmonary disease and refers to having emphysema and/or chronic bronchitis. You will feel more in control when you learn how living with COPD affects your breathing and what steps you can take to feel better. Step 2. Recognize what makes your symptoms worse. COPD is progressive and may worsen over time. People living with COPD can experience an exacerbation or flare-up that may require medical attention. Exacerbations can be caused by COPD, triggers like tobacco smoke, colds or respiratory infections. Symptoms of a COPD flare-up include worsening shortness of breath, increased cough, fatigue, or loss of energy, change in the color, thickness or amount of sputum, mucus or phlegm. These symptoms are different than what you experience on a day-to-day basis. Work with your provider to develop a plan that outlines steps to follow when your COPD is under control, getting worse, or when your symptoms are so severe that you require immediate medical attention. Step 3. Follow your treatment plan. There is not a one-size-fits-all treatment for COPD, so work with Dr. WHO creates a plan that helps relieve your symptoms. Discuss with Dr. about topics such as medications. Step 4. Understand ways to manage your COPD. The medical report said there is no cure for COPD. With the help of Dr. ABODA, there is a treatment and a possible cure for COPD with his natural herbs. But treatment and management can help slow COPD progression and control symptoms, so you feel better and able to spend more time doing what you enjoy. Talk to a doctor. Dr. ABODA and attend scheduled appointments. Take your medication as prescribed. If you smoke or vape, we can help you quit. Talk to your provider about increasing your physical activity. Discuss with your provider or a dietitian your concerns about weight and nutrition. Talk with your loved ones about planning for the future. Learn breathing techniques like belly and pursed lip breathing. Talk to Dr. ABODA Healthcare about meds that protect you against infectious respiratory diseases like COVID-19, flu, and pneumonia. Step 5. Find support. You are not alone. Help and support are available. Support community. Taking care of your emotional health is as important as taking care of your physical health. At times, most people living with a chronic health condition like COPD experience sadness, fear, and worry. If you find these feelings are not going away and the changes in your mood are affecting your ability to keep up with daily activities and things you enjoy, talk to a healthcare provider doctor. Talk to a registered specialist at the Lung Helpline. +2 349064108 102. More frequent questions the Lung Helpline receives about COPD are questions about managing COPD, quitting smoking including vaping and e-cigarettes, oxygen therapy, financial assistance programs and more. Contact the Lung Helpline. Call +2 349 064 108 102.